And this program enables officers to provide a life-saving tool to individuals at risk or to individuals who have a family member or a friend who is at risk. Essentially, it's police officers taking a harm reduction approach that focuses on keeping our citizens safe and recognizing that drug use is a health issue.
While York Region Public Health says York has one of the lowest emergency department visits and deaths related to opioids, they are still seeing a rise and want to be prepared. According to preliminary data, in 2021, there were 58 opioid-related deaths, a 16% decrease compared to 2020 when there were 69 opioid-related deaths. All opioid-related deaths were accidental. 25 to 44-year-olds experienced the highest proportion of opioid-related deaths. Approximately 38% of fatalities were unemployed individuals, 31% in employed people, and 31% with unknown employment information. The most common opioid-related death was related to fentanyl.
Citizens from the Newmarket area, Aurora, or King City can either request an officer, frontline officer, for a naloxone kit, or they can attend one district at 429 Harry Walker Parkway South in Newmarket and request to get a naloxone kit. These naloxone kits are free and no identification is required to get one.
Naloxone is a drug that can temporarily reverse the effects of an opioid overdose. Once taken, it will begin to work in 1 to 5 minutes and stays active in the body for 30 to 90 minutes. York Region Public Health says the pandemic fueled an increase in drug use across the province, citing a report done last year by Public Health Ontario.
Increasing unpredictability of the unregulated drug supply, reduced access to healthcare services, limited access to community-based services and programs that support people who use substances, and also increased isolation that contributed to more people using drugs alone during the pandemic.
York Regional Police say they are hopeful those who need the kits aren't afraid to come get one.
The pilot project is going well in terms of training officers, teaching them about stigma, harm reduction strategies. It's slowly rolling out. I would like to see an increase in the number of kits that we are providing.
The kits aren't the only tool being used in York Region. Work is being done on prevention, treatment, and harm reduction as well. For City News, I'm Maleeha Sheikh.